Hello everyone, my name is Bessie, and today I'll talk about self-care for family members who have a loved one having a mental illness. So first of all, I would like to acknowledge, as a family member who taking care of a loved one having mental illness is a very stressful job, and many of you are doing a great job at being a family member as a caregiver. And first of all, I would like to say self-care is very important to being a caregiver, because if you want to take care of others, you need to take care of yourself first. Just like how you are on the plane, they always explain to you before you put a air mask on other people, you need to do it on your own first. Because being able to take care of yourself, then you will be able to take care of others. Otherwise, it would be the other person taking bad care of you. So how are you doing that for those who have a loved one having a mental illness? The first time when family members discover a loved one who have mental illness usually are when the loved one are undiagnosed. That started with when they are become very stressful and probably having dysfunctioning relationship between the family members, and the caregiver role are usually the first person discover there's something wrong, something is not working for my loved ones, and that is where the family members start to seek out and look for services or help. For caregivers, they can go to self-help support groups where, for example, Mood Disorders Association has a lot of self-help support groups, and also other agencies in the Lower Mainland also have the self-help support group. For example, at Canadian Mental Health Association, they have the Chinese Family Support Group as well, and also some inpatient units, they also have the Family Support Group. You can go to heretohelp.bc.ca to find out more information. So support group can become part of your self-care, because you will find other people in the group also sharing the same story as you. And as you're talking with others to learn more about the information, you find the support that you need. If that is not enough, you can also go online and also use self-help books to learn more about the illness. The key point is to, by you learning more about the illness, you'll be able to let your family member understand more about the illness. Of course, they would need professional help at a point if it's unable to do the self-help. And as a family member, if you know more about the illness, you will be able to understand what is needed for your loved ones. And for example, the way you talk to them, you can give them more empathy and understanding for what's going on, what's happening, instead of reacting to some of the situations. So that's the first part of self-care. And second part is to finding yourself. That involves finding your true values. A lot of times when you're the caregiver of somebody, it's often that you lose yourself in giving care to other people. And where do you put yourself in? Therefore, we need to look at, define your own value, who I am. Being a caregiver is just one role of your life. You probably be a mother, you have a job, or being somebody in a basketball team or volleyball team member. So being a caregiver is just one role of your whole life. Therefore, if you see that as just part of your life, then start taking care of yourself by focusing on other roles as well, so that you're not overwhelmed by just being a caregiver. And also to set goals for your self-care. That's like taking care of your own hobbies, or taking time to relax, taking a hot bath for yourself, and really just having some long times, because a lot of time, especially taking care of a loved one who have mental illness, is very emotionally draining. Then being able to take time for yourself and recharge your own needs is one of the key points for self-care for family members. And also, when you're finding support by going out with your own friends, having the social network, that would help as well. And also looking for support from the community, like I just mentioned, using support groups and some self-help groups, online forums. Probably a lot of you are already doing that. If you haven't, you can start searching for all those information, because there are a lot of information online that you can look for. Also, at a point, you might also want to get professional help as well. For example, talking to a therapist to talk about your own difficulties or stress when you're taking care of a family members. Doesn't necessarily mean that you become sick as well. It's exactly because you don't want to become sick as well. So you want to prevent it by start being open about your emotions, start being open about how stressful you feel, or just get some support, get some other people having an understanding of what you're going through. And lastly, set the realistic goals for yourself. So sometimes in the past, before your loved one having a mental illness, you might expect your loved ones to do something for you. For example, if it's your partner, you might expect the partner taking care of the kids or running household things for you. But at this point, if your partner is no longer being a healthy, functioning level, then you might want to reconsider what are the realistic goals at this point. Maybe taking more responsibility, and then having your partner recover, and giving more space for your partner, giving more space for the loved one who have mental illness, to set a realistic goal for them. So this is the very small tips, and hopefully that's helpful for you. And if you want more information, you can go to Mood Disorders Association of BC to look for more information. Thank you.